Hey everyone, so today we'll be discussing disc displacement with reduction. Now, I'll be talking about it from this book, which is Temporomandibular Disorders, a very good book for understanding TMJ. Now, let's first understand the normal movement of the TMJ. Now, there are two phases, as we all know, to the mouth opening. The first phase is, as we know, a purely rotational phase, and it is a hinge action. Now, the mouth opening which we attain from it is 17 to 20 mm. Now, the second phase of joint movement is a transitional or a sliding movement, which occurs in the superior joint cavity. Now, in this movement, the condyle, it moves through the zones of the articular disc. It moves from the posterior band to the intermediate zone, and finally it comes to rest at the anterior band of the articular disc. Now, during this process, this whole complex, it is moving down. It is moving down the anterior slope of the articular eminence. It is moving down. So, when this is happening, there are basically two forces which are acting on the articular disc. There is a force which is pulling it forward, which is by the superior head of the lateral pterygoid muscle, and then the reverse, when the joint is closing, the elastic recoil of the bilaminar zone is pulling it back to put it back in its place over the condylar head. So this is how a normal TMJ joint it works. Now next we'll be discussing what happens in disc displacement with reduction. Okay, so now that we have understood how a normal joint functions, let's now try to understand how disc displacement with reduction happens. So if the joint is damaged or overloaded in any way, there is a tendency for it to cause increased tonicity in the pterygoid muscle. Now this is the important part. There is increased tonicity in the pterygoid muscle. So what this causes is, it tends to pull the disc forward. As you can see in this diagram, the disc is, pulled forward. So the rotational phase will remain the same. But when the transitional phase happens, the head of the condyle will slide forward and it will impact against the thicker posterior band of the disc. So as you can see here, when it will move, it will impact against the thicker posterior band. So as it is opening more, there will be a build-up of friction. Ultimately, the condyle head will jump. It will jump past this portion and resume its normal position. Now, when this jumping is happening, there will be an audible release of energy, which is the clicking. And this is disc displacement with reduction. So this is disc displacement with reduction. The reduction is happening from the anterior displacement of the disc. So I hope you understand the concept of disc displacement with reduction now.